Welcome to today's deep dive. We're going to be looking at a study from the Journal of Veterinary Science.
Okay.
And the title is a little bit of a mouthful. Cervical spine reconstruction after total vertebrectomy.
Okay.
Using customized three-dimensional printed implants in dogs.
Wow.
So get ready for some neurology talk today.
Absolutely.
But we'll break it down and explain why this is really pushing the boundaries of what we can do surgically.
Exciting.
So to set the stage a little bit, canine vertebral tumors are a serious issue. And often surgical removal is the best option.
Right.
But when you're talking about removing an entire vertebra, a total vertebrectomy in the cervical spine, that's the neck.
The neck. Yeah.
It's incredibly complex, especially in these small animals.
Yeah, it's incredibly challenging.
So why is the cervical spine so tricky?
So the cervical spine, it's a very delicate area.
Yeah.
Limited space. You've got the spinal cord, right?
You've got the vertebral arteries.
Right.
So many vital structures.
Yeah, and the potential for complications is huge.
Yeah.
Life-threatening.
Absolutely.
So this study is exploring this new approach.
Okay.
Using these customized 3D printed implants to reconstruct the spine after you take out this vertebra.
Yeah, so you remove the vertebra.
Yeah.
And then what do you put in there?
Right.
You stabilize that.
Exactly. And they did this with beagle cadavers.
Okay.
They created virtual models from CT scans.
Right.
And then they surgically implanted these implants.
Yeah.
So there are some really big questions here.
Okay.
How safe and accurate was that placement? You know, are we going to damage something putting these screws in?
Exactly. You don't want to damage anything. You want to be really precise.
Exactly.
Yeah.
And then how stable is that reconstructed spine?
Right, because you need that stability for the spinal cord compared to a normal spine.
Yeah.
Or even other ways that they try to reconstruct it. So let's dive into the results. The first thing they were looking at was safety.
Right.
And they used this screw grading system.
Okay.
Grade 0 is no breach.
Okay, perfect.
Perfect. Grade 1 is a minor breach.
Okay.
Grade 2 is a major breach.
Right.
So what they found was that 90% of these screws were grade 0.
That's great.
Which is amazing.
Yeah, that's really good.
There was a slightly higher risk of breach in the ventral screws.
Okay, so the ventral screws are the ones on the bottom.
Yes.
The front of the spine.
Right.
Okay.
As opposed to the dorsal on the back.
Okay.
So they looked at accuracy too.
All right, so how do they measure accuracy?
They looked at the deviation from the planned screw position.
Okay, so they had a plan.
Yes.
Pre-surgical plan.
Exactly.
All right, and then they saw how far off they were?
Yeah, how far off were they? And what they found was that the dorsal screws...
Okay, the ones on the back?
...were more accurate in the entry point.
Okay.
But the ventral screws had less angular deviation.
Oh, interesting. So a trade-off there?
Yeah.
Okay.
So stability is kind of the big one here.
Right. We need that stability.
We need to make sure this thing is going to stay together.
Exactly.
And they used what's called a 4-point bending test.
Okay.
To measure range of motion.
Okay.
And neutral zone.
And they were comparing this to...
the intact spine.
Yes.
And
a plate and pin reconstruction?
Yes. Okay. So what they found was these 3D printed implants significantly reduced motion.
Okay.
Which means it was really stable.
Yeah.
In fact, it was better.
Wow.
Than the plate and pins.
So it was more stable?
Yes.
Than even the traditional method?
Yes.
That's amazing.
Locally.
Okay.
Yeah. So it was a stiffer construct in that area. So that's
it's very interesting.
That's really exciting.
Yeah, it really is.
So what does this all mean?
Yeah, that is the big question.
Yeah.
We've seen these great results, but can we actually use this in practice?
Right.
Well, you know, cadaver studies are great, but they're not real patients. So there are definitely some challenges in translating this into actual dogs. You know, cadaver doesn't heal. There's no blood supply. There's no risk of infection.
Right. So, yeah, it's a very controlled environment.
Exactly. Right. So we need to be able to replicate this in a living patient.
Right.
With all of those factors.
Absolutely.
Yeah.
So thinking about things like how well will this actually heal?
Will it get infected?
Right.
Yeah.
What's the dog's?
And how is the dog going to
quality of life
function?
Yeah. Can they actually walk?
Exactly.
Are they in pain?
Right. Are they going to be able to go for walks again?
Yeah. You know, all of that.
Yeah.
Another challenge I see with this is the cost.
Oh, yeah, absolutely.
3D printing is not cheap.
No, it's not.
Especially when you're customizing.
Custom designed implants for every single patient, it can get very pricey.
So how do we make this accessible?
Right.
To,
that's a big question.
The average dog owner.
Yeah.
And then there's the surgery itself.
Right.
This is not
an easy surgery.
An easy surgery.
Yeah.
This is very specialized.
Very specialized. You need a lot of training.
Yeah.
Specialized equipment.
So not every vet can do this.
No.
You need those resources. You need to be trained specifically.
Right. And that takes time.
Yeah.
And money. To be able to do that.
Yeah, absolutely.
And then, of course, we have to think about the ethics.
Always.
Right?
We have to make sure.
Making sure we're doing what's best.
That this is actually beneficial.
For the animals.
For the patient.
Yeah.
And not just.
Right. And not just,
a cool new technology.
A whole new thing.
Right.
So, I think,
This study really lays the groundwork.
It does. It's a good foundation.
It shows the potential.
It does.
But we got to figure out.
We have to figure out the next steps.
How to actually apply it.
Yeah, exactly.
But it's exciting to think about.
It is exciting.
You know what this could mean.
Yeah.
For these dogs.
Yeah, imagine a world where we can,
create the perfect implant.
And perfectly reconstruct this.
For that specific patient.
And give that dog
a
good quality of life.
Absolutely.
So this has been a fascinating deep dive.
It has.
Into the world of cervical spine reconstruction.
Yeah.
I want to talk about one other thing.
Okay.
This study focused on the cervical spine.
Right, the neck.
But we know vertebral tumors can happen anywhere.
Anywhere in the spine.
In the spine.
Yeah.
So could we use this for other parts?
So that's a great question.
Yeah.
And I think theoretically, yes, the technology is there.
Yeah.
But the design of those implants would have to be different.
Right, because the thoracic vertebrae...
Yeah, they're shaped differently.
They're shaped differently.
They have ribs attached.
They have ribs attached. The lumbar vertebrae...
Totally different.
They're weight-bearing. They're much bigger.
You got to have something strong.
Absolutely.
In there.
Yeah.
So different challenges.
Yeah.
But I think the 3D printing...
I think it has the potential.
Has the potential to
adapt to those different areas.
So it's exciting to think about.
It is.
The possibilities.
It really is.
Of, creating these implants.
Custom implants.
For any part of the spine.
Anywhere in the spine.
Yeah.
That's amazing.
This has been a really incredible deep dive.
It has.
I've learned a lot.
Me too.
And I'm sure our listeners have too.
I hope so.
But before we sign off,
okay,
I want to leave everyone with one last thought.
Okay. I'm intrigued. I'm all ears.
Those ventral screws.
Yeah.
The ones that had that slightly higher risk.
Mm-hmm. The higher risk of breaching.
Yeah. Is there any way to make that better?
That's $1 million question.
Right? Yeah.
I think there are a few things we could try.
Okay.
One thing that comes to mind is using intraoperative imaging.
Oh, okay.
So like fluoroscopy.
So you can actually see.
You can see in real time where that screw is going.
As you're putting it in.
As you're placing it. So you can make adjustments.
That makes a lot of sense.
Yeah. And I think another thing is looking at the implant design.
Okay.
Can we change the screw design?
Yeah.
The thread patterns.
Right.
The materials.
Yeah.
To make it
work better?
Work better.
In that area of the spine.
So it's all about refinement.
It's refinement of the technique.
Yeah.
Refinement of the technology.
Yeah. This has been really cool.
It has been.
I mean, to think that we can create these custom implants.
It's really amazing.
For these dogs.
It is. It's personalized medicine.
For our patients.
It's really amazing.
And it's not just limited to the spine.
Right. We talked about that.
Yeah. We can use this for other
bones.
Bones, other joints. It's really...
The future is bright.
It is. It's a very exciting time to be in veterinary medicine.
So for everyone listening out there.
Yes.
Thanks for joining us for this deep dive.
Yeah. Thanks for listening.
Into the world of canine spinal reconstruction.
We hope you learned something.
It's been a really amazing journey.
It has.
And we'll see you next time.
From Vet Neurojar. Keep those minds-inspired hearts light and tails wagging.